Kylie is live in Chandler this morning, hoping to get some answers from Arizona's top doc in regards to all of this. Kylie.
Good morning. We are here at the Chandler-Gilbert Community College. Dignity Health was running this vaccination site. The state takes over today at noon, so we are here today to talk obviously about that, but also answer some of your big vaccine questions. So let's bring in Dr. Cara Christ. Good morning. Good to see you again.
Good morning.
So we know that earlier this week you guys announced a new approach. You're going by age. So you started obviously 75, 65, 55. It'll continue from there. The question this morning is, what about those essential workers, especially those grocery store workers who have been on the front lines and now they're frustrated that they maybe have been bumped and aren't able to get the shot as soon as they wanted?
So our essential workers actually are still part of our hybrid prioritization. So our counties are going to be working directly with employers of grocery stores, convenience stores, those that have been listed as frontline essential workers, to get them vaccines so that they can vaccinate their employees.
So when is that going to happen? Because we know these people who have been on the front line since day one, they're ready to get protected.
It's actually going to happen a lot sooner than it would have had we not reprioritized. So the Janssen vaccine is coming in, and that's one of the vaccines, that's that one dose series. We believe it'll be here by the beginning of next week. And that's going to be prioritized for our frontline essential workers, as well as, working with the counties to get employer-based vaccination sites. And so they'll be starting as soon as they can.
So I know that obviously can get a little confusing when you talk about the state and the county. Talk a little bit about why you feel it's important to have maybe different models where you guys are focusing more on age and then they're going to be working on getting these essential workers vaccinated.
So the counties in Arizona really are the boots on the ground. They're the experts in their communities. They work the front lines every single day. They know who their employers are, where their communities are, where they're hard to reach vulnerable populations. They know where to go to meet the population where it's at. The state is very good at the logistical things. So running these big sites, finding volunteers, being able to manage these, we can take that off of the county's plate so that they can focus on essential frontline workers and vulnerable, hard to reach communities.
We know yesterday those 50,000 appointments filled up fast. I was on there trying to get an appointment for my dad. Luckily, I was able to do that. It took about an hour. Some people weren't, though. You got excited, you thought you got the appointment, and then a couple of clicks later, it went away. Was there a glitch or was it the demand? What caused those issues?
So it is the demand, and that's one of the pieces of feedback that we are working. So hopefully the next time that we open up appointments, that should be resolved. It's been one of the priorities of the things that we're fixing on that site.
And that leads to our next question. When could we see more appointments? Because clearly there is a big demand.
So there is a big demand, and we only opened up appointments for a couple of weeks because we want to monitor how we're going through these prioritization groups, and we don't want all of the appointments to be taken as we move through. So we will be opening up appointments within the next week or two.
So if I'm out there and I'm 30 years old or I'm 40 years old, when am I going to be able to get a shot and not have a problem? Not like it be a Taylor Swift concert ticket or something where it's so hard to come by.
So what we believe, looking at the number of doses that we're getting right now, is we should be able to move through the age groups. We opened up 55 and above in March. Sometime in April, we should be able to move to our 45 and above, end of April, beginning of May to the 35 and above. And by summer, we should be able to get 16 and above.
Are we talking early summer? Are we talking May, end of May, beginning of June?
End of May, beginning of June, likely, based on what the vaccine projections look like. Now, we've all seen there have been manufacturing issues, there have been weather delays. But looking at our current projections, that's kind of where we're estimating we'll be.
Dr. Christ, we appreciate your time, guys. Coming up in our 9 o'clock hour, we're going to ask her some more questions about that Johnson & Johnson vaccine, and then also get her take on Texas. I know we've mentioned it in the newscast. That state, obviously one of the biggest states in the country, they are lifting their restrictions. So we'll ask Dr. Christ what she thinks about that and what her conversations with Doug Ducey, our governor, are regarding restrictions in Arizona moving forward.
It doesn't look like there's too many cars behind you.
Well, it starts at noon, so they're prepping right now. So clearly at noon, lunchtime, that's when things will really get rolling here. They got some time to get the volunteers and get all the workers and stuff in order, making sure they're good to go when they take over this site.
All right.
Thank you, Kylie.